I'm going to talk a little bit about the psychological disorder, obsessive-compulsive disorder, and a couple of patients who suffer from it. So, pretty much OCD is the uh, person having obsessions about completing certain tasks that they compulsively satisfy by carrying out behaviors to sort of make themselves feel better about the ideas they're having. And that can be manifested as, incessant hand washing or locking a door or something like that. So the two patients we'll look at today are Anthony, a 50-year-old man from New York, as well as the famous TV personality and comedian Howie Mandel. So starting with Anthony, he's a 50-year-old man who has just recently been, or I guess understood his diagnosis of obsessive compulsive disorder. He claims that he tells us that he went since age 6. He's went through his life with, every day and pretty much every minute affected by him needing to carry out these compulsions due to his obsessive thoughts. He gives the example of having to set down his pencil at his desk when he was in elementary school, 12, 14 times in a row until he had set it down just right. So what we see there is a really, I guess, pervasive aspect of this disease or this disorder. It doesn't really leave you alone. And he says that having OCD has caused him extreme losses of confidence, and pretty much no real encouragement can come from it because, like we said, it's really hard to pretty much carry out any action, opening a door, washing your hands, or really, picking up anything, really doing anything is going to have, it's going to be a process for you. And he claims that this really made him feel isolated from other people because he looks at people who don't have OCD or don't have a psychological disorder and sees them, carrying out simple tasks with such ease that it makes him wonder, what's wrong with me and why am I, why do I have this disorder that makes me so different? And it's really important in his case because he didn't really understand what was wrong with him until, in his 50s. So that's very difficult for someone to go through because his whole life he didn't know what was wrong with him. He just knew that he was different, and isolated. And frankly, from his account, he sounds very ostracized. So, and we see much the same thing with Howie Mandel. Now, he's obviously a very successful person who's been very famous in his life, but he talks about a lot of the same things that Anthony does. He talks about, once again, that loss of confidence, which is kind of hard to believe for a guy like him, but still he talks about being embarrassed a lot because you think about Howie Mandel, on his TV show Deal or No Deal, for instance, he could never shake the contestants' hands. He always had to fist bump them. So he was pretty much being publicly displayed as someone who was so, I guess, different. He was so obsessed with contracting an infection or, getting some sort of germs on his hands that he wasn't able to, carry out a normal function that any other human could do. So, this separates him from everyone else and, understandably so, makes him feel embarrassed. Another thing he talks about is the difficulties that arise when trying to raise a family because he's got a wife and a couple of kids, but if one of his kids, for instance, were to be sick, he says that he can't be in the room with them, as his mom, as the mother would with, just caring for her child. He has to, put on a face mask and put a gown and gloves on because he's deathly afraid of contracting some disease from the child, but this is his child whom he loves. So, I mean, so you can tell that it's not his child who's at fault here. It's his own disorder that he clearly struggles with and clearly regrets having, because, like we said with Anthony, it affects every single action of his daily life. So once again, you have that loss of confidence that we see in these patients, and it's really hard for them to deal with, because and it's really hard for us people who don't have OCD to understand, because they deal with this every single moment of their lives, where we do so many things without even thinking about it, and it's a very involved process for them just to get through the day. And you look at a man like Anthony; he's gone since he was the age of 6. He's dealt with this. But I guess we'll bring it all back by saying that as far as our interactions with patients suffering from OCD are concerned, it's really important that we understand them as a person, because if we just look at them as someone with OCD, or even Howie Mandel's instances, he's someone with OCD, or he's just a famous person, we have to be sure not to fall into that tendency, because that really prevents us from seeing them as the whole person that they are, and that prevents fruitful relationships from forming, and in general that depletes the respect for human life that all people should have and foster. I think that if we really put ourselves in the shoes of these people who suffer from OCD, or at least try to understand the daily struggles that they encounter and overcome, respectively so, I think then we can really understand what it means to be someone who suffers but also overcomes. And this allows us to gain that respect for other people, and to really develop a beneficial community for all, where everyone experiences the love that they should and the receptiveness that they should. And in the end, that is what we can do to help these patients with OCD who really don't have much of a treatment at this point. We simply can be open to them and be welcoming to them, and pretty much help fight that loss of confidence and that ostracism that these people suffer from. And once we really care for the person in that respect, then I think we will have established a good community and good relationships with people who are just like us. They're just people. So that concludes it for today. Thank you for listening.